Last month, we showed images of sleeping staff at Wootton Lawn, a mental health unit in Gloucestershire, and heard stories of patients getting on the roof, wandering onto railway tracks, one being discharged, then throwing himself off a bridge minutes later.
Just walked out of the door and jumped headfirst off a bridge. And he had smashed his skull, smashed his face, had a brain hemorrhage, smashed 2 arms and 2 legs, and punctured his spleen.
The NHS Trust said it received positive feedback, but acknowledged they didn't always get things right. A year earlier, Sky News also gathered damning testimonies from numerous patients at mental health services run by Huntercombe Group.
I thought I went there to be kept safe.
And I'd learn new ways to self-harm. I don't feel they made me any better. I think they made me a lot worse.
The group said it was taking steps to improve its care. But it's these stories and others that have led to the government launching a national investigation into inpatient mental health services.
The new Health Services Safety Investigations Body will investigate the following themes: how providers learn from deaths in their care and use this learning to improve services, including post-discharge; how young people are cared for in mental health inpatient settings, and how this can be improved.
There is already an inquiry into nearly 2,000 deaths over a 20-year period in mental health services in Essex. When it was launched, some campaigners, like Melanie Leahy, refused to take part because it didn't have the power to compel witnesses to give evidence. Her son Matthew died at the Linden Centre in Essex.
How many more have to die before the statutory powers are given?
2 years later, the inquiry chair complained that only 30% of staff witnesses were freely contributing to the investigation. So now the Health Secretary has given the inquiry the powers it needs to make people give evidence.
You know, this has taken over 10 years of my life to get this far. The people that have helped have been immense, but we now need to work so much harder now to get this inquiry up and running with the right terms of reference, the new chair, and, you know, we're ready to start work.
The scandal of mental health care failings have been slowly coming to light, and mostly through the sheer grit and determination of those who've suffered the consequences. Jason Farrell, Sky News.